So it's all about understanding and education and to see past the fear mongering. And that's
Mm.
one of my biggest pet peeves and issues with marketing today. They're using fear mongering and trying to scare pet parents into thinking that other diets are bad and that their diets are the only diets that are going to save their pet's life or make them live to be 100. And that's not the case.
Hello, everybody. Welcome to MythBarkers, where we make dog parenting easier by sniffing out the facts and debunking dog tales.
Today's episode is about something we've been eager to dive into since we started MythBarkers. It's all about dog food and nutrition. If you look back over the last 150 plus years, the way we feed dogs has greatly evolved from when dogs were first domesticated and eventually considered companion animals to what they are now. And now I feel like there's so many options for our four-legged family members. It's actually overwhelming for a pet parent to be able to decide what kind of food they should be feeding their dog and how to keep them healthy and happy. Fortunately, our guest today has dedicated her career to health and nutrition of our canine companions and other companion animals, and we're really excited to get to the bottom of a few myths about dog food.
Our guest today is a doctor of veterinary medicine and one of a handful of board-certified veterinary nutritionists in the US. She co-founded her vet practice, Peak Veterinary Specialists in North Carolina, where she focuses on clinical nutrition application in pets. She also currently leads Artie's advisory team, a group of experienced veterinarians, pet food formulators, and industry experts guiding all aspects of Artie nutrition planning, meal plan design, and recipe development. Please join us in welcoming Dr. Lindsay Bullen to MythBarkers. Hi, Lindsay!
Hi, guys. Yena and Laura, it is such a pleasure and a privilege to be here. When I got this invitation, I was absolutely thrilled to be able to share to the world and to all of your viewers, no matter where they are, the myths and the truths. So really excited to be here. Thank you for the invitation.
Thank you for joining us. There's so many myths about dog food and nutrition, so I think we should jump right in, and probably one of the biggest, most prominent ones out there.
Yeah.
Is kibble really bad for dogs? Or is this just a marketing message that's been created by other fresh and raw food dog companies?
Yeah, so it is not. It is not really bad for dogs, which I am sure a lot of people know that already. But one of the challenges is as pet parents, and I'm a human parent and a pet parent myself, all we want is what is best for our babies, right? Whether they have fur or otherwise. And when we see information out there that something could potentially be harmful, our gut instinct is to do a complete 180 and steer away from it without necessarily diving deeper. And so we can certainly get into the nitty gritty of it, but there are some kibbles that might be less desirable. There are some that are life-saving. All of my fur babies have medical issues, and the diets that I feed them as their mommy, I could cook for them, I could get fresh for them, but they're both on kibble and they have saved their lives. And so to answer that question in a quick and dirty, no, kibble is not bad. And I hope you ask me a ton of more questions about the ins and outs of why it isn't.
Yeah, actually, I'm really glad you mentioned there are good types of kibble and bad types of kibble. Can you create a distinction between them?
So I certainly can try, but it takes a lot of investigation from the pet parents and from the veterinarians involved.
Mm.
So to me, a good kibble is going to be something that meets and adheres to the World Small Animal Veterinary Association, or WSAVA, guidelines. And those are going to be things like, do they employ professionals for formulation and development of their food? And it expands beyond that. So when we think of a professional, we might think of a master's nutritionist, which is certainly better than a self-proclaimed nutritionist, a PhD formulator, a board-certified veterinary nutritionist. And
Mm.
truthfully, the more the better, in my opinion. I think that having a group of experts on a single project is wonderful to not only make sure that we don't miss anything important, but to also call each other on our BS, right? Like if you don't have a colleague that is willing to step up and say, hey, times have changed in the past 15, 20, 35 years since you were last doing this. This is now safe or this is now dangerous, that sort of thing. That is what drives science. That's what makes us better, is having that colleague that can help us grow and strive for excellence. And so when we think about pet foods, whether it's fresh, frozen, it doesn't matter. Taking a look and seeing if they're transparent, do they share the type of experts that are involved? Are they even consulting with experts? There's different categories. So do you have an expert, yes or no? If you have an expert, what are their credentials? How long have they, been employed? What is their background? That sort of thing. And that's just step one, right? So you have people that are working on product development, but then do the companies listen? So I've dabbled, if you will, in advising several different companies, and sometimes they listen 100%. We do this for the pets, and safety and well-being should always be the top priority. Don't get me wrong, it's a business, right? You have to make money. Of course you do. That's not wrong. But the safety is the top priority. And so that's my job at Artie, is making sure that we are adhering to the strictest of safety protocols. And that is my job, whether I'm practicing in the clinics or advising other companies, is saying, hey, we can do better because we should do better, right? And so it's hard to distinguish because it takes time and effort to find the answers to these questions.
We want our listeners and our audience to leave with kind of practical tips and advice that they can use to better the lives of their dogs. So you mentioned looking into the individual companies and who's actually doing the formulation and the creation of that food. Are there specific ingredients or call outs on dog food packaging and dog food brands that pet parents should look for and then also avoid when they're choosing what kind of food for their dog?
Yeah, that's another great question, and one which your listeners will probably be frustrated and or disagree with me on. So if a pet has a true hypersensitivity, so an allergy or an intolerance to an ingredient, then absolutely you should take a look at that ingredient list and say, is there anything on there that my pet can't handle? The thing to keep in mind is that ingredients are the vehicles for nutrient delivery. The body doesn't need ingredients. It doesn't need chicken. It doesn't need chicken fat. What it needs is amino acids. So those building blocks, the essential amino acids, it needs essential fatty acids for skin health and brain development and all of these things. And how do we get that? We get it from the ingredients. So again, if a pet has a known hypersensitivity, or even if the pet parent or the veterinarian is suspicious, take a look at that ingredient list. But in general, the ingredient list, it has to be on there in terms of regulation, but it's just another way for marketing to market. And it's another factor of confusion for pet parents. So chicken, if you look at that as the first ingredient, it has to be listed in order of descending weight. So the heaviest, the most inclusion by weight is first, followed by the least, right? And so chicken, as it is, with 70 to 75% water, is going to be listed first, but it's 75% water. Whereas chicken meal, which is dehydrated, taken away, still potentially a very high quality source of essential amino acids, might be second or third or even fourth on the ingredient list. And so pet parents will look at this and be like, well, chicken is the third ingredient over here, but the first ingredient over here. So clearly, the one where it's the first ingredient is a superior product.
Right.
That is not necessarily the case, because ingredients do not dictate how appropriate the diet is for the pet. That's based on nutrient profile. So what is the protein content? What is the fat content? What is the digestibility? So how easy is it for the individual pet, for their GI tract to use the food? What's the bioavailability? So what is the concentration of essentials versus non-essentials? The biggest things is that my pet parents, when I have a patient that needs a very specific nutrient profile, and there's one or two commercial products out there, they look at the ingredient list and they're like, this cannot be good for my pet. And I'm like, let's do this. Let's talk about the ingredients, but it's not the ingredient that's bad. Your dog needs a highly mechanically processed food so that their GI tract doesn't have to work so hard. That's why this diet is better. So it's all about understanding and education, and to see past the fear mongering. And that's one of my biggest pet peeves and issues with marketing today. And it keeps me in business. Don't get me wrong. I was worried I wouldn't have a job when I finished my residency. I'll be in business forever if marketers keep this up. But they're using fear mongering and trying to scare pet parents into thinking that other diets are bad and that their diets are the only diets that are going to save their pet's life or make them live to be 100. And that's not the case, right? Instead, I implore pet food companies out there, and I try to advise Artie on this too. Ignore everybody else. They do them. I tell my kids this. I'm like, you do your business, they do their business. But let's
Mm.
talk to our pet parents about why our product is good. What is it about it that's unique? But don't compare in a negative way to other companies. You're just spending your marketing on fear mongering instead of using that money for science and for the betterment of the pet and for the betterment of the world. So that is my 2-minute soapbox.
I mean, that was really enlightening, and I love the concept of figuring out what the pet needs rather than what is marketing telling us, because
Yep.
traditionally throughout all aspects of life, we can see that marketing campaigns are not always 100% truthful. And so when we're
Yeah.
observing our dogs, how do you determine what kind of a diet that the dog needs, including the allergies that they may have or may not have?
Oh, that's a great question. So it should always start with a visit to the vet. And I see that because the whole goal of a generalist is that they're the experts in everything, right? And they're really going to be the ones that know your individual pet from the time they were a puppy or a kitten or the time of adoption. And so that person is a huge advocate, not just for you as a pet parent, but for your pet as an individual as well. And so, A, they have to get to know them. B, that physical exam. And there's a lot of myths about this too, that veterinarians are in it for the money and the costs, go into our pockets. I don't know if most people know this, but vets don't make crap, okay? Not anymore. We know the same amount, and I would argue more than medical doctors. And I can say that because my dad is a human surgeon. And I'm like, one organ system on one species, right? I know all the organ systems of multiple species, and I know how to communicate appropriately to my pet parents. Now, not every veterinarian does, we all need a little bit of help with our bedside manner, but, we go through the same, if not more school than a medical doctor. We get paid significantly less, think 3 to 4 times less. Most of us are in debt until our 70s or 80s. We don't get a chance to save for retirement. And now, because of the world we live in, most of the veterinary hospitals are owned by corporations, which means that we as veterinarians have no say whatsoever in cost or anything like that, right? And so the point here is that you have to take your dog in to have these exams, to see the generalist who knows them inside and out, to make sure your pet stays safe and healthy, right? So it's preventative medicine. And pet parents are like, well, they look fine, so you're just trying to get money. And I'm like, no, the blood work that we ask you to run is a quick snapshot of how your animal is doing on the inside. Animals are really good at hiding when they aren't well until they hide under the bed and it's an emergency, right? And we don't want that. We want to make sure that your pet gets the highest quality of life for the longest time that is possible. And the only way to do that is to take them in for evaluation from somebody who knows what they're talking about. And my other soapbox here, which I hope everybody hears, is that our generalists should be advocates for nutrition. But there are only a handful of veterinary schools now that have clinical nutrition services that are taught by board certified veterinary nutritionists, because nutrition is not as lucrative as other specialties. It is starting to go the way of the dodo, which is, I think, a huge travesty and doing our pet parents and our patients a huge disservice, and the veterinarians that pay all of their life savings to go to school. And so the main questions that veterinarians get are, what should I feed my dog? What should I feed my dog? My dog's poop looks funny. What should I do? What should I feed my dog? And we are not empowering or educating our veterinarians because there aren't nutritionists at the vet schools anymore. And so it doesn't mean that you shouldn't go talk to your vet about food. They're still an advocate. And they still know more than most people out there, but they also know where to find the information, right? So if they don't know the answer to a question, I always implore the veterinarians that I mentor, it's okay to say, I don't know, right? Say, I don't know, but I'll find the answer for you. Or I'll refer you to somebody who knows the answer. But nutrition, which is a science, is so emotion driven nowadays because it's the one area that pet parents feel like they have a semblance of control. And then
Right.
it's confounded by all the misinformation out there and all the judgment. If you don't feed fresh, you're a bad pet parent. If you don't home cook, you're a bad pet parent. If you feed kibble, which is baked at 1,000 degrees and full of carcinogens, you're a bad pet parent. First of all, That's not true. It's cooked to an internal temperature of 165, which is the same temperature as my chicken, and it's baked at like 325, which is the same temperature that we bake chicken, right?
Wait, so can we just
So,
debunk that right now? Because I have
yes,
fallen for that
yes,
marketing method.
please. Yes,
So,
please.
so dry kibble, not air dried or freeze dried,
It's
is
like a
safe.
cookie. It's just baked.
It's
Yeah.
not
It's a
cooked
cookie.
at a high level that is cooking carcinogens into the food and making your
Or
No,
dog more
killing the
prone.
nutrition.
no. Well, so let me go to that one, okay?
Yeah.
So it's a cookie. It's baked. Now, again, different companies might have different quality assurance programs. The good ones are not going to be over baking. They're not going to be burning things, right? And I'm sure you guys have done your research and have looked into the advanced glycation end products or AGEs. And there is some truth to cooking of anything can increase some of these end products, which
Mm.
in high quantities can sometimes be inflammatory. But that's what tastes good. So when you are browning your butter and you throw and saute the onions in there until they're caramelized, have made ages. And when you are searing the outside of your steaks or your pork or whatever it is, you are making ages. And so different cooking methods have different levels of these end products. So that is definitely true. But the challenge is that people think the food is causing the cancer. The food is actually what made our pets stop dying at 6 years old and live to
Mm.
be 14 or 15, right?
Yeah.
When you get old enough, your body stops destroying cancer cells. That is unfortunately what happens with aging. And we are just letting our pets live to be the age where they can actually get cancer now. And to your question, Yena, so cooking of anything can degrade certain nutrients.
Mm.
So there's something called stability or lability as well. So minerals, for example, are usually pretty stable when it comes to cooking, whereas certain vitamins will degrade in light or they'll degrade with certain temperatures. So the
Interesting.
good companies that have good nutritionists who understand the individual parameters of each nutrient and how they react with different cooking temperatures, the different timing, the different storing temperatures, light exposure, even how ingredients play together, right? Yes, there is degradation, but the companies take that into consideration. So pre-cooking, the nutrients that they know are going to degrade are increased by the fold that it degrades. So by the time the cooking is
Gotcha.
done, they are now at a safe level and they're at the level that the pet needs. And so all of the testing of the product, again, that the good companies do, will send the end product out and then test it and make sure that all the levels and parameters are met. But that's not what was added to the food. So they know how all these things work together. And the challenge is that it's easier for life and medicine if we assume everything is black and white, but we all know
Yeah.
we live in a beautiful world of gray or a less beautiful
Hmm.
world, depending on where you're at right now. And so with vets, it's easier too. It's like, well, I read this was bad, so don't do this, instead of taking the time to really investigate and think about it, right? So kibble is bad. Well, some kibble is bad. Not all kibble is bad. Kibble has saved lives, saved my pets' lives, you know? And
Agree.
so it would be inappropriate for me to say that every pet food company out there has to have millions of dollars to spend on quality assurance and all of the nutritionists and all of the pathogen testing. That takes time and effort and funding, but it should be every company's desire to get there eventually, right? So with a startup company, I am not surprised when they don't have a board certified nutritionist on staff. I'm not surprised when they are not sending it out for testing every time because those are thousands of dollars. But I want that to be on their plan. And again, with Artie, I'm a huge pain in their ass because I was like, if you want my name on it, you have to send it off for thousands of dollar AFCO testing. You have to send it off for pathogen testing. You have to do feeding trials. And they're like, man, this is hard, but we're
Yeah.
going to do it because that's what's best for the pets and for the pet parents.
So is all of this information available on AFCO? Like all of the testing that has been done by the individual companies? I know this is a lot for one pet parent to research, but I
Oh,
also
so
think if
much.
we
Yeah.
have some guidance on where we can find this information, whether or not
Yeah.
it's opaque or transparent, it might give us a good starting point to start to sort out like these companies are really trying to do it right.
Yeah, no, that's a great question. So, things to keep in mind is that AFCO, which is the Association of American Feed Control Officials, is not a true regulating body. So, there are a bunch of really amazing scientific professionals that get together. They have multiple meetings throughout the year. And I actually have it right next to me. Every year, this is the 2023, they publish this ridiculously massive
Wow.
book. I know, and I read it every year. Some of it
Oh, wow.
is, I'm going to be honest, like a little dry, but I pour myself a small glass of bourbon and we get through it over the course of a month or so. But they do a good job of saying, hey, this is what was updated, this wasn't. So they try to help us out a little bit. But there's really good information, but they're regulation guidelines and recommendations only. So the challenge is that it is then up to each individual state Department of Agriculture and the US Department of Agriculture, and we know how the government's going right now,
Yeah.
to make sure that the companies are following the regulations, right? So the states say we are going to adopt these regulations, and then it is the individual USDA and state DA agents' job to say, is everybody following that? Now, as you can imagine, when you walk into a PetSmart or a Petco or whatever it is, there's hundreds of diets in there. And so usually the biggest ones that people are fearful of using are the most scrutinized because they have the biggest face. So it's a little bit like Starbucks, right?
Mm,
So I try really hard to support my local coffee shops, but I keep going back to Starbucks because their coffee and their chai is just so consistently good, right?
mm,
And I'll still go support my local coffee shops, but it's usually for like a cookie or something. Whereas, the big companies, nobody wants to use them because they're big and they make money and all the things, but I'm like, they're the ones that have the money to do the research, and their diets
exactly.
are consistently good and tested,
Mm,
and they have the most professionals working on it. Does it mean that there aren't mistakes? Of course not. To err is human, right? But what you do in the face of a mistake is really what sets you apart. And those companies that are like, well, we've never had a recall, we've never had an issue. I'm like, are you looking for it? Are you testing? What is your traceability? What do you do when a client calls with a concern? So, to get back to your question, is there a place, not a great place, that you can find all of this information? But the Pet Nutrition Alliance, which is another group of amazing independent professionals, has a wonderful website where you can type in the manufacturer, the name of your food. If they were one of the many hundreds that they had called and asked questions about, it will pop up with the answers that were provided. If your dog's food is not on there, then it just means that they weren't part of that initial inquiry. And so I usually tell pet parents if they're not on there, they were probably too small or not available at the time. Doesn't mean they're bad, but it probably means they're small enough that it requires a little bit more investigation, right?
mm,
When you look at the answers, the possible answers are like, here are the answers to the questions. So full transparency, declined to ask, which in my opinion, or declined to answer rather, which I think is the worst answer. That means you acknowledge that you got the questions and you said no. And so if I see that and I'm talking to a pet parent, I'm like, I don't trust them. I'm like,
Yeah.
what do they have to hide? They shouldn't be hiding anything because of the safety of the pet. Like, absolutely not. And then did not respond. I don't love that answer, but I'm like, I'm really bad at emails, which I know you know because I just accepted the invitation today for this. So, like, did somebody like me not get the email? And I
mm,
honestly don't know if the Pet Nutrition Alliance sent an email or called or followed up. I'm not sure how they collected the information, but there's so many did not respond and declined to respond that I'm like, I would much rather have you choose a product that I don't know about that at least answered the questions than one that
right.
I don't know about that didn't think it was worth their time, right? There is
Yeah.
nothing secret on there. Literally, the questions are, do you employ a board certified or PhD nutritionist or both? And so, yes, no, what are the credentials? Okay. Do you own your own facilities? Yes, no, in part. If not, what percent? Most of the manufacturers have co-packers, right? So it's really hard and really expensive to 100% own everything. There are some out there that do. So it's
Mm,
not bad if they don't. I think that there's more risk associated because you're trusting another company to uphold the stringent quality standards. But almost everybody does that. So I'm like, that's not unusual. And then they will also say, hey, I want this nutrient level. Like, what is the nutrients level? Just to be like, can you provide it? Because
mm,
so many pet parents are like, do I actually need a prescription? Or is there a diet out there that can fit my pet's needs? And if the company refuses to provide that information, or if the information isn't accurate, that's very, very harmful. So again, there's only like 5 or 6 that really set the gold standard, if you will. Doesn't mean everybody below that is bad, but there's that variation. So when I have a pet parent talk to me, they're like, well, what about this food? I'm like, let's look on their website and see how easy it is to get in touch with their customer service. Let's see if they have any myths on there that we need to talk about. And then let's see if they're on the Pet Nutrition Alliance and how transparent they are. There was a company one time I called and it was like, we're sorry, we're so understaffed. We can't answer your phone right now. And I was like, does that mean your quality is also understaffed? Or like, I would rather just say, we can't come to the phone right now. Like, I appreciate the honesty,
It's not
but I
great.
was like, oh
Wow.
God, so like,
Mm,
do they have a nutrition department? Is there somebody you can talk to? These are all the things that really set the stage because most of it is just marketing. And one of my good friends, and she's a mentor, Dr. Lisa Freeman. I'm sure you have heard of her. She's at
mhm.
Tufts University. She does a lot with the cardiology group and the whole dilated cardiomyopathy thing that came out, in 2017, 18, 19. And one of her quotes, which I'm going to bastardize, so please forgive me, Lisa, is that, the marketing has outpaced science and it continues to do so.
Absolutely.
It
Yeah.
continues to do
In
so
so many categories.
in so many categories. And when the scientists try to speak up, we are accused of taking bribes, not knowing what we're talking about, that our education is whatever. And I'm like, you can't fight crazy. That's true. But we definitely know more than a lot of people think we do. And I can
Yeah.
debunk another myth right now. It would be unethical for me to take money from a company to recommend their product. I don't do that. That's medically unethical. Nutritionists don't do that. We take
Yeah.
money to educate, to promote wellness and science. And anytime we're, talking, we have our full list of financial disclosures, which I would be more than happy to provide you guys to put on your website. I have about 50. At the end of the
Mhm.
day, veterinarians, nutritionists, anybody in the medical community, and I hope anybody in the scientific community is going to make the recommendation that is best for the pets and the pet parents as a whole, because that is the right thing to do.
I can't believe you're saying all of this. It's also so much more complex than I was expecting it to be. I guess I
Me
shouldn't be
too.
surprised that marketing messages have become so deep and inundated that I have fallen for them. And I spend my life now in the dog space. Okay, so
Yeah,
what's actually real? Like, we want pet parents to take the onus on themselves of
yeah,
investigating, looking into the brands that they're choosing. And I think it's so important that you highlighted not to poo-poo the big brands because they do have the setup infrastructure to hopefully
yeah.
create a good product. And it's probably, again, just deep marketing messages telling you that this craft fresh is better than this well-established company
Huh,
that everyone knows. I don't want to make it too overwhelming for anyone who's listening.
of
And I
course.
want people to leave and go, okay, this is something I could look out for and
So what
things
can I
that feel like
do?
I'm educated, right? Obviously, we talked about the importance of vet care and bringing your dog to a vet for a wellness visit. For pet parents, though, what is a sign that they should look out for if a diet is not working for a
No,
dog
that's
at
a great
home?
question. So, one of the biggest is a picky pet. I get this all the time where they're like, well, my pet's just picky. They've been picky since the time that, we got them. And I'm like, listen, so 40,000 years ago, okay, not recently, for all of those that are out there, dogs are actually not carnivores. That's another myth. They're omnivores. They
Mm,
diverged from their wolf brethren 40,000 years ago. That's enough time for their GI tract lengths to differ, for the concentration of digestive enzymes to differ, for their salivary amylases to differ, all the things. So no longer carnivores, okay? So at the time, think about a starving wolf. They are going to eat whatever. They're going to eat trash, right? Because they need the nutrients. They need to get whatever they can. We don't feed our animals trash. Of course we don't. But we have now bred these like beautiful, cute, floofy, adorable, or hairless babies for how they look and potentially their personalities, but we're also potentially breeding other things that we don't see until later, right? So a lot of these problems will pop up later. So most of the patients that I see, and I see clients all week, the biggest complaint is my dog is picky. But it's because the food is bad. I'm like, well, they're probably picky because they have underlying GI disease, or they have a sensitivity, or there's something about a particular product that is setting them off, or maybe their nose is hypersensitive. But usually pets are picky because they have underlying sensitivities that are going on, not because the
Wow.
food itself is bad. It's the food isn't the right food for them. So that's like phase one is my dog is always picky. And don't get me wrong, like they're just like kids, right? There are certain foods that I prefer or not prefer, but at the end of the day, my hunger signals are they're very strong. They're strong enough that I'll be like, I didn't want that for dinner, but I'm going to eat that, right? And so I have an hour-long discussion on appetite regulation, which is way too dry for your readers. But the point is it's a balance between hungry and not hungry signals. There's only one hormone, which is ghrelin, that makes you feel hungry, and everything else makes you feel not hungry. And other things that get added to the not hungry list is pain, stress, gas, anything that can affect the body and put it in a state of just not general wellness can turn off sensing hunger. And that can result in those picky types of behaviors. So again, can you truly have a picky pet? Of course you can. Can you have animals that have their feeding preferences or their smell preferences? 100%. But if you get that puppy, kitten, whatever, and they have been picky from the time that they were little, you might want to look into that. So that's kind of step one, picky, especially if they used to like their food and now they don't like their food anymore and there hasn't been a formulation change. So any changes to feeding behavior, which is called dysrexia. So you're still eating, but it's not with the gusto it used to be, or the timing has changed. So they'll still eat 100%, but now they don't eat in the morning, things like that. That is dysrexia. That's a change of feeding behaviors. That's a sign that maybe they need a little special food TLC. And again, doesn't mean that the problem is with the food specifically, but it might not be the best food for that pet. The stool character. So another one of my favorites is, well, diarrhea is normal. And I'm like, diarrhea is never normal, actually. It might be common or quote unquote normal in your particular pet, but diarrhea in general isn't normal, and that warrants further investigation. So they might have the best appetite, they might love the food, but if their stool is not in those perfect little Tootsie Logs that are easy to pick up, they don't leave a big old mess, it's not constipation, they're not crumbly, there's no straining, but if they're not that perfect 2 out of 7 on the fecal score scale, so we can link that to your guys' website as well, then I would recommend investigating further. Do they need more fiber? Less fiber? Is there a time of day that their stool becomes soft? Is it after exercise? Is it after their flea, tick, and heartworm prevention? There are things that can kind of clue us in that there might be, again, a hypersensitivity. It's most commonly associated with dietary protein, but in rare cases, it can be carbohydrate ingredients. It can also be additives. So here I am talking about how kibble isn't bad and it isn't, but I definitely have a handful of patients that just do better on fresh food because they're so hypersensitive that I don't necessarily, and nor do my pet parents, want to spend, months and months teasing out the individual preservatives or other agents like that. And there can be sensitivities to that as well.
Or what
And
about the
so,
proteins too? I feel like there's so many sensitivities here about, okay, shepherds with their chicken or pitties with their chicken and beef. Is
yep,
there truth to that? Is it the protein or is it something else?
it's usually the proteins if they are going to have an issue, but GI disease in general is so multifactorial. And my little puppy, you might have seen his tail. We just adopted the Boxer German Shepherd mix, and he's going to turn a year in a couple of weeks, but we got him at 5 months old, and he's a GI kid. I mean, he came and was waking me up every 3 hours with horrendous diarrhea, with urgency, and we did all the things. We dewormed him, checked him for all the stuff, and I was like, baby, I think you have GI disease. Of course you do. And I switched him to a hydrolyzed puppy diet. Within 2 days, his stool is better. That's the food he's on. If you deviate, and when I say you, I mean my 9-year-old boy and my 6-year-old boy, when they, give him a bite of chicken tendies, which I'm like, don't do it. I know he has diarrhea. If somebody accidentally leaves the cat door open and he eats some of the cat food, he definitely has diarrhea. And he was 5 months old when I diagnosed him. And the reason why we're seeing more of it, a lot of us are doing the right thing and we're adopting our pets, but we don't know their full history. So early antibiotic use, and I'm not saying that it's inappropriate, like boy had parvo and kennel cough, he needed antibiotics. But everybody thinks about the GI tract in terms of digestion and absorption, and that's right. But it's the second largest immune organ in the body. It is an open tube from mouth to bottom, and it has to protect the body from literally crap that dogs will eat, and viruses and parasites and bacteria. And if there is any sort of illness from the time they were little, when they're developing their GI tract, when they're developing their innate immunity, it can set them up for failure in the future. And so again, a lot of pet parents are like, it's the food, it's the kibble, it's the this. And I'm like, or it's the fact that your dog had parvo when they were little and or giardia and they were treated with metronidazole for 6 weeks. And
Right.
again, like it's not that the antibiotic is inappropriate, it's that they were set up for failure from the beginning. And it's just so multifactorial. But as pet parents, we want to find a single cause so we can stop it and fix it. So that's kind of the environmental part. But then we have, the nature, if you will. So not the nurture, the nature. Again, we are breeding animals that are cute and fluffy and have beautiful temperaments. And they also usually have these weird sensitivities. So German Shepherds do have shorter GI tracts. That is true. So they need very highly digestible diets. And a lot of pet parents will get Shepherds because they're cute and they're smart and they don't understand that Shepherds have a very unique length of GI tract. And then boxers get something called boxer colitis, which actually benefits from different types of treatments. And so here I have a boxer shepherd. There's so much that goes into the development of a working system. And there's so much that can negatively impact a working system. And again, it's easy to say it's the food. Now we can fix the food. The food might help it improve or get better, but it is likely that it wasn't the food that caused the issue in the first place, right?
The antibiotics piece is so
Wow.
interesting, and I'm wondering what can we do to proactively support our dog's GI systems? Because I don't want people to hear this and go, "Oh, I put my dog on antibiotics, now I have
Of
to
course.
worry." What can we do to help? Is it probiotics? Is it something else? Do you have recommendations?
No, it's a great question, and I wish there was a simple answer. So in my puppies and kittens, when they are developing their immunity and their GI tracts are still developing, if they need antibiotics, then they need them. But I definitely recommend that any pet that is getting antibiotics be put on a probiotic, and not just during the duration, but for months afterwards. One thing to keep in mind is just like food, different probiotics do better or worse in different animals. And so it might take one or two or even three different trials to find the one that works best for them. And then they also have to make sure that they're not giving the probiotics at the exact same time that they're getting the antibiotics, right? So if the antibiotic is 8 a.m., 8 p.m., and you give probiotics at 8 a.m., 8 p.m., well, you're going to wipe out everything in there. So trying to stagger it. So like 8 a.m.
Wow.
antibiotic,
Okay.
noon probiotic, 8 p.m. antibiotic, that sort of thing. And then again, keeping them on it after the antibiotic is stopped so it helps their GI tract recolonize is going to be very helpful. And then potentially trying to slowly taper and get them off of it. Not giving antibiotics is not an option. When you need it, you need it. They are life-saving. But also pet parents recognizing that most cases of diarrhea don't need antibiotics. That's one
Right.
of the biggest things I see. Like, it's the holidays and your dog takes a big old deuce right in front of the door and you're like, I can't even deal with diarrhea right now. So you call your vet, give me the drugs, give me metronidazole, I need it now. And most vets are like, just give it time. And they're like, but there is no time. Our guests get here in 5 minutes, give me the metronidazole. And a lot of us do because we understand the urgency. But I would argue that's actually not good antibiotic stewardship. So there are anti-inflammatory components to tylosin and to metronidazole, so that can help. But most diarrhea, especially if it's dietary indiscretion, tends to be self-limiting. But nobody wants to wait, right? So think about when humans have GI upset and we're like, ugh, it hit us. Usually within 24, 48, maybe if it's really bad, 72 hours, it's over, it's done. But we have toilets and they do not. And so it's up to us as good pet parents when they got to use the potty,
Yeah.
like we need to try to balance with our partners if we have partners or dog walkers or friends. Like, I have a meeting, but they have a GI bug right now. Can you please let them out every 2 hours? And that might give us the time to let their GI tract kind of resettle, recolonize without wiping out their natural microflora every single time they get diarrhea. Oh,
So my dog recently had diarrhea and thankfully didn't give him any medication for it. I just wanted to make sure that I'm giving him non anti-inflammatory food and just to sort of wait it out. Um I'm not sure if I did the right thing, but for someone struggling with this issue of their dog
Yeah.
having diarrhea, what is the best protocol to make sure that they're not unnecessarily given medication that they don't need that's harming them?
So my first rule of thumb, if the pet parent is ever worried, then it's automatically an emergency, okay? So I never try to tell my pet parents not to go see their vet. I'm like, if you have a concern, especially if the weekend's coming up, go get your pet evaluated. Absolutely. So nobody will ever argue with that. If you're wondering if there's time, like what is the true sense of urgency? If your pet is still eating, still drinking water, still acting relatively normal, and they just can't hold their poo, then there is likely time to give it, for it to work itself out. Because that's literally it. It
Mm,
has to work itself
Right.
out. And then there's probably going to be a period of time after the initial diarrhea episodes where you're like, well, now they haven't pooped in 12 hours or two, or even a day. Well, you have to get the food back in there, digesting and absorbing again. And the body tends to overcompensate in either direction, if you will. So it's like, I'm mad, diarrhea. And it's like, okay, I'm not mad anymore. No poop for a day.
mm.
But if your pet is physically acting normal otherwise, as hard as it is, especially with the houses, like put them in an area that has tile or linoleum or in a crate that's easier to clean, and just make sure there's frequent bathroom visits. Give it time, really.
Mm.
Just like humans, dogs and cats might get GI upset a couple times a year. If they are otherwise healthy, usually self-limiting, within 3 to 5-ish days. And you should see improvement after about the first 24 to 48 hours. If you're not seeing improvement, definitely go see your vet just in case it's something weird. If it's
Would
a
you change
GI dog, oh
anything
yeah.
about their diet during this time?
So you're going to get different answers from different vets. It really depends. If there is a known cause, right? So, like my dog got into the trash and now there's diarrhea, I'm not going to change their food. Their food wasn't the problem in the first place. It was the fact that they ate a bunch of trash.
Right.
Or so my dog's name is Dingleberry. um, and he is we call him Barry or
Oh
Bear
my
for short,
goodness.
but when he's really naughty, I call him Dingle. But we've
Oh.
been through 5 different remotes. He likes to chew the buttons off of the remotes and then leave the rest. We always do the battery hunt, the plastic hunt, and then the
Oh
next day
no.
I see Disney, Netflix, and YouTube in his poo.
Oh.
He's very naughty, but my children also have to learn to not leave things on the floor. So we're working through that. But he's eating well, he's acting normal, and I see the diarrhea, and I'm like, you're still going to stay on your food because I know you got into something. Or
Yeah.
if I see the kids be like, well, I gave him a French fry, I'm like, for the love of God and for the love of your mommy's heart and gray streaks, you can't give the dog. And they're like, but it was just one. I'm like, doesn't matter. Like, he's that sensitive. He really is. The only thing he can
Mm.
have is like peeled apple slices, and he can have one. And then it like sets him off. So if food was not the cause, I don't change the food if it's just diarrhea. So I had
Gotcha.
somebody call me the other day because one of my patients who's on a very strict diet presented with diarrhea, and the primary veterinarian wasn't aware of the specialized food, which is why it is always important, whether your vet asks or not, to volunteer what your dog is eating. That's
Mhm.
a huge piece of information for pet parents out there, right? Especially if you're worried your pet has a hypersensitivity. And this client is a friend of mine. She texted me. She was like, so they want my dog to be on chicken and rice because everybody says bland, right?
Right.
Put him on a bland diet. I'm like, bland isn't a thing. It's not a thing for dogs. It is for us. So bland for us is no spices, no flavor, no like hotness, no spiciness. Okay. Bland for a dog, what does that mean? Is it low fat? Is it highly digestible? So really, if your vet ever tells you feed him a bland diet, advocate for your pet and say, what do you mean by that? Which diet would you like, right? Because it's
Yeah.
super vague. And I'm trying to teach vets not to say that too. But when my friend was like, hey, they want to put her on chicken and rice as a bland diet, I'm like, you do that and she's going to poo everywhere for 2 weeks because she's allergic to chicken. I was like, do not do that. The reason she has diarrhea is because you went out of town and she got stressed out, and this is stress colitis. And now we have to get her back into doing what she needs to do. She's eating well, she feels good. Keep giving her her food because it wasn't the food's fault. Now, the caveat to that is if somebody gets into the trash and eats a bunch of fat, right? So, garbage gut leading to pancreatitis, so inflammation of the pancreas, high fat and high protein content can overwork the pancreas if it's already mad. If it's not mad and it's not one of those breeds that predisposed, you don't need to change it. But if there's any concern that your pet doesn't feel well, They're not eating well, they're vomiting, their stomach actually hurts when you touch it. If pancreatitis is on your veterinarian's list as a concern, then you definitely want to talk with your vet about the fat content of the current diet they're on and one that is potentially lower. So, for example, if a dog gets pancreatitis and they're on an appropriate diet, so I've got another patient that's happening to right now, I'm like, it isn't the food. The food is already the lowest that we can go. It's probably the fact that she got into this and had a GI tract flare, then became dehydrated, and then the pancreas got mad. So we have to treat her supportively, but if we change the food, it could actually make her worse. So if they're already on an appropriate diet for the disease process, don't change it. Support them through it. If they're not eating well, don't change it. Give them anti-nausea medications to help them not feel sick. Give them appetite stimulants to help them. If they need fluids, make sure they're getting plenty of hydration. If they are on a diet that is not ideal for the reason why they're sick, then of course change the diet. But most pet parents are like, well, it's the food, we got to change the food. But that can actually compound the problems because we don't transition. So
Exactly. That's what I was
That's what I
thinking.
was just about to ask you. Yep.
yeah,
Yeah.
like transitions are where it is at. Okay, so I used to live in Switzerland. So I was over there and I was studying nutrition, and we ate super healthy. It's super expensive to eat out in Switzerland. So I was cooking fresh food literally every day. And because I didn't have a job, I was just studying. I was very privileged. I would, go to the grocery store, plan our meals, do all that. We came home and I was like, I haven't had unnamed burger in a long time. And worst GI upset of my life for like days. And it was because my
Man.
gut bacteria wasn't used to it. I wasn't used to that high fat, the high sodium. My body was like, what have you done? Now, don't get me wrong. I don't eat that food often anyway, so fast food, just because I'm trying to be very healthy and a health nut. I want to live forever. But if we don't transition our pets, it might be a nutrient profile thing. So low fat to high fat, we got to give their body time. Or it could be a fiber thing, high fiber to low fiber, or vice versa. Or it could be an ingredient thing. Maybe they do have a poultry intolerance and you went from beef to poultry. There's so many variables with commercial pet food, whether it is fresh or not fresh, that we don't often know the cause of some of these changes. And so again, if the diet is otherwise working and I can find a reason for illness or a flare, don't change the diet. If the diet isn't working or we diagnose something different, otherwise healthy, now they have kidney disease, of course, change the diet, slow, gentle transition to let the body acclimate. But as I mentioned before, every pet, just like people, they're unique individuals. And so when I do my consultations for clients, they get 5 different diet options. And I'm like, on paper, every single one of these should work for your pet, but your pet is unique. So try option 1 first. If it doesn't work for them, go back to your old diet for a couple weeks, let them reset. Then we're going to try option 2, slow, 15 to 30-day transition, go back, try again. And the transition rate is based on your pet. It's not based on your desire. And it takes patience and time and maybe a glass of bourbon or two. But
For people who are switching, though, is there a more doable time frame that you recommend? Is it
I
like within
usually
a week
recommend
or?
7 to 10 days for healthy animals, 14 to 21 for any animal that has a concern for sensitivity.
Okay.
Yep,
So, do the needs of our dogs change based on their stage of life? For example, puppy
absolutely.
stage, adult, and senior. And what are the dietary requirements that change over time?
Yeah, that's a great question. So, what we have to remember is that there's a couple different factors that veterinarians and nutritionists use to calculate calorie intake. It's still just a place to start, back of the bag for all of your listeners out there, just a place to start. There's an obesity epidemic out there. So, if your puppy or kitten is getting chunky monkey, back it off. All right. It is way easier to back it off when they're a little overweight than it is to do a full blown weight loss plan. All right.
Mm,
So, when we have our puppy, if I wanted them to stay the same weight forever, that would just be like base metabolism, right? But we know puppies and kittens, they're actively growing. And the amount of nutrition that they need it's called accretion, to basically add to all of their different organs, to add to all of the tissues that they have in their body, is ridiculous. So all of us have what is called a resting energy need. In humans, it's usually called a resting energy expenditure. In animals, we call it a resting energy requirement. So that's kind of the baseline, and it's the same equation no matter what species, no matter what age, it doesn't matter. So that's the same equation. But then there's a factor, so 2, 3, 4, 5, 6, 7, whatever, that you multiply it by to estimate their calorie needs. And as long as they're being fed a complete and balanced diet for that life stage, then the nutrients will obviously increase proportionally with the amount of calories they're eating, right? And so, for example, my children, so again, I've got a 9-year-old boy and I've got a 6-year-old boy, and they eat 2 to 3 times what I eat in terms of body condition, if I were to body condition them. So, different scales out there for you pet parents, but the 1 to 9 scale is the most common. 1 is emaciated, 4 is athletic ideal, 5 is couch potato ideal, 6 is a little overweight, anything up to 9 is morbidly obese, but now we have to add like 9 plus 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 plus, things like that. And so my children would be like a body condition of 3 out of 9 because they just cannot put fat on their bodies. Now their muscle is out of control. Like my 6-year-old has an 8-pack. I was like, I don't even know how that's possible. And so does my 9-year-old actually. But from a fat perspective, the only fat they have on their body is in their heads for their brain. And they eat so much food. And now for me, so I just turned 40, I'm a reluctant 40, and I'm trying to be 40 and fabulous. I'm eating between 1,400 to 1,600 calories per day, and my children are eating over 2,000, almost 3,000. And obviously, like if they had their choice, it'd be sugary badness, but mommy makes sure that it's nice and balanced. But they eat more than I do every single day, and they're always starving. They're metabolizing so quickly because their body is not trying to maintain their weight, it is trying to grow. So with puppies and kittens, they're obviously starting at like 500 grams, half a pound, whatever it is. And someday, depending on the breed, they're going to be, you know, a 2-pound Chihuahua all the way up to my 70-pound puppy that I have over here. He's huge. I got him when he
Wow.
was 40 pounds. He's doubled in size since I've had him. And I
Yep.
feed that
And he's still
dog.
growing.
He is
Yeah,
still
he is.
growing. So when I calculated, okay, so I got him at 40 pounds and I calculated I was feeding him 1,300 calories per day for a 40-pound dog. Now he's 70 pounds and I've backed him off a little bit. He's eating between 1,000 and 1,200, and it depends on his activity level, right? So you asked about needs. It's not just calories because calories provides energy. But when you are growing, or if you are feeding for reproduction, so mommy is having to grow babies, you have to have those extra nutrients. So calcium and phosphorus and magnesium for bone development, amino acids and fatty acids for neural development, you know, DHA, which is one of the biologically active omega-3s for cognitive function. You know, every nutrient that adults need, growing animals need as well, but in higher quantities to put that tissue on and to do it normally. And one of the challenges is that any sort of malnutrition during development can set them up for failure. So Dingleberry's sister actually came over yesterday because she has GI disease too. And I am their nutritionist vet. And so they did a play date and she is half his size. She had parvo and kennel cough, but Barry got out of the hospital. She had to stay in it for an extra couple of weeks because her pneumonia was so bad. So she did not grow during that entire time. Her GI disease is more severe than Barry's. And so she has been set up from the beginning to have a harder time than he has. And she is literally half his size. And so, again, you know, a lot of times we get these dogs that we don't know their history, and it all impacts how they do over life. Now, for maintenance, that one's more broad, right? So if they're otherwise healthy, when you look at the back of the bag, there's something called a nutrition adequacy claim. And it tells you what species is good for, so dog or cat, tells you what life stage, so growth, maintenance, or reproduction, or all life stages, something like that. And then it'll tell you if it's undergone feeding trials or if it's just been formulated, and we can certainly talk about that later. But that tells you that the diet is designed for that species, for that life stage. Reproduction is actually harder on the body than growth is. And so, you know, if anybody is breeding animals out there, please make sure that you talk to a good theriogenologist, your veterinarian, and a nutritionist. There's so much misinformation about calcium supplementation or not, puppy diets versus not for reproduction. So that's a whole nother thing. And then you have geriatric, right? So there will be a geriatric life stage coming down the pipeline. But as we know, anything that the government is involved in takes some time to go through all the regulations. And so when that is going to come to pass, I honestly don't know the answer to that, but it is coming down the pipeline. But right now, if a diet is labeled as geriatric, mature, senior, whatever, it's maintenance. It's maintenance, and then it is whatever the pet food company's philosophy is. So
Gotcha.
some geriatric animals are low energy overweight, so maybe their geriatric diets are going to be lower calorie. Most, geriatric patients actually have muscle loss, and they tend to have higher energy requirements. And so that company's philosophy might be higher protein, highly digestible, more calories. As we age, our senses decline, so less olfaction, less taste buds. And so that's one of the reasons why geriatric pets don't eat well. And so they're going to be using more olfactants, more palatants, and again, higher
Oh,
calorie density.
interesting.
So you get more calories per bite. So right now, there is no delineation, but in the good companies, or the ones I should say that do the most research, we know the trend, and like I know the trends for a geriatric patient, but like if you were to come to me and you were like, hey, my dog is perfectly healthy, but they're 12, what do I feed? I'd be like, are they doing well on your current diet? Yes, they
Mm,
are. Then there's no reason to feed it, like change. There's no reason at all. But if you come to me and you're like, well, there might be evidence of chronic kidney disease, they're not a clear stage 2, or we just heard a new heart murmur, or they're slowing down a little bit, maybe some joint issues, I'd be like, okay, now we can talk. Like we can definitely take a look at the diet you're currently giving, see if there's supplements that can augment it, or if you heard a heart murmur but you don't yet have an appointment with a cardiologist to make sure that things are good, let's take a look at the sodium content and just make sure it's okay. But if it ain't broke, don't fix it. My last
For
dog was on the same diet until the day she passed unexpectedly. And my dog before that was on the same diet till he was 8 years old. I used to run him 6 miles a day. He was a performance dog and he was on an all life stage performance diet. And he had no problems whatsoever. Like he unfortunately passed from a type of cancer that is very common in his breed at a young age. And
mm.
so it wasn't the diet. It was, genetics related, unfortunately, and the diet remained appropriate till he was older.
Am I correct
Mm.
to assume that the puppy life stage is formulated differently to address the needs that you were talking about? The
That is
different.
correct.
Okay. So
That
it
is
is important
correct.
for people who are listening when you have a puppy to feed them a puppy specific food, not adult
A
lifestyle. Because
100%.
I
And
see a
that's
lot of people
another
do
myth.
that. Yeah.
Yep. So there, in larger breed dogs, there is an increased risk of them developing developmental orthopedic disease if they are fed a diet that is inappropriate. But now AFCO has regulations guiding for all life stages or puppy growth, including large breed animals over 70 pounds. So the energy density, the calcium to phosphorus ranges are appropriate for reducing the risk. Obviously, nothing is going to be 100% because there's so many other variables that can impact that. But I have seen so many animals that are put on an adult or maintenance diet too soon, and it has negatively impacted their well-being because, people were told from somebody else who had less experience that puppy diets cause disease, so you shouldn't do that. I'm like, nope. Your pet is growing, they need a puppy diet. But again, you have to look at the back of the bag because even my colleagues will be like, hey, I was thinking of switching my puppy to adult, blah, blah, blah. Is that okay? And I'm like, well, that one is complete balance for all life stages. So, like, it's actually not that different.
Mm.
So, just look at the back at the nutrition adequacy claim, and that will tell you as a pet parent, is it appropriate for your pet? And there's a lot of good information out there, but instead of acting reactively, be proactive and talk to your veterinarian and say, hey, I'm thinking about adopting a Great Dane or a German Shepherd or another King Corso large breed dog. And I've heard that there's an increased risk of X, Y, or Z. What should I feed to help reduce that risk? And be proactive about it.
That would be the ultimate best case scenario for
Yeah.
like the pet parents and the dog. How do you advise dog parents regarding the food that they give their dogs versus the supplements to enhance the diet? How important
Yeah.
is the supplement? Is it needed? What kind of supplements do you think are necessary or helpful?
Yeah, so again, I'm sure there's going to be people that have a different opinion. If a pet is fed a complete and balanced diet, and it'll say this diet is formulated to be complete and balanced for blah, blah, blah. If they are fed a complete and balanced diet and they do not have anything wrong with them, so they're otherwise healthy, it is unlikely that they need any additional supplements. But as humans, we should rotate what we eat so we get all of our vitamins and minerals. Most of us should take a multivitamin. Disclaimer, not a human doctor, but I'm a darn nutritionist and I used to be an athlete, but I want to be geriatric athlete. And I take really good care of myself and I still have vitamin D deficiencies because of a medication that I'm on for genetic whatever. And so I do need to take supplements for me as an individual. My children take multivitamins every day. I try to feed them really, really well, complete and balance all the things to the best of my ability, but they're on multivitamins. But our dog and cat food, if it's from a reputable manufacturer that does feeding trials or at least has data analyses, that has multiple experts on it that do these types of analyses, it is unlikely that your pet actually needs any supplements. And adding supplements can actually unbalance the diet. So too much of a good thing is a bad thing, right? So a beer for me as a woman who's allowed to drink legally is just fine. A 6-pack is not just fine, all right? So the vitamins and minerals that are in our pet's food, just fine. They're in the right concentrations and proportions. Extra vitamins and minerals can cause a mismatch and cause sometimes lethal consequences. So I don't even mess with it unless it's needed. Now, if I have a pet parent that wants to be proactive, like my dog, tore his ACL when they were younger, did X, Y, or Z, do you think that they need a joint supplement? I'll be like, you know what? They have an orthopedic injury. Those have been known to predispose potentially to arthritis, or your pet has been overweight, even though, we don't see any limping now. That increases force on the joints. Sure, let's go ahead. And if there's a supplement that does no harm, and I look it over, I'm like, you know what? I don't think it's necessary, but it is not going to hurt. Then I'm like, of course, if it makes you feel better to do it, let's do it, right? So with heart disease, for example, there's a lot of heart supplements that have taurine and carnitine and CoQ10 and, antioxidants and omega-3s. And I'm like, your dog has a benign murmur. It's physiologic. The cardiologist said the heart was totally fine. But if it makes you feel better to give this supplement where I've looked at every single ingredient and it's from a reputable manufacturer that does quality assurance testing, if it makes you sleep better at night, I have no problem with it whatsoever. Go for it. But not all supplements are benign. And supplement regulation is the Wild West. At least with pet food, the big guys are under the gun all the time. The supplements, every single one on the back is like, this statement has not been evaluated by the FDA. It's like, okay.
Right.
So,
this is
and
fascinating.
it's the marketing messages again that are getting to us saying, oh, you need this. Your dog needs to be on
correct.
this, when it turns,
Yep.
you're saying it's not the case.
Nope. And if you, and all these supplement companies are gonna be so mad at me, but if you look at the actual concentrations, because it's dangerous to give high amounts,
Right.
it's like placebo levels, right? It's not enough to actually have an impact if they were to need it, because if it was that high, it would make the diet dangerous or it would unbalance things. And so again, I tell my pet parents, unless we know there's a deficiency, we're not going to do it. Now, again, some supplements are benign. Like, for example, B vitamins tend to be pretty darn innocuous, right? But things like vitamin D or calcitriol, I am not about to supplement with a fat-soluble vitamin that is stored in the body and can cause liver and or, in these cases, kidney damage if I don't have a darn good reason to do it. And a lot of supplements have random stuff in there. So I'm like, it's not broken. Don't fix it. Save your money on good food. Save your money on annual veterinary visits. Save your money on the blood work, right? You don't know your pet is healthy. You don't know what the baseline is unless you do the blood work, And if, I have animals come to me at 4 and 5 years old and they're like, I can't believe that they developed this disease so young. I'm like, well, they might have had it this whole time, but we don't know because we didn't have any baseline labs. So, it isn't just a way for veterinarians to make money. This is a way for us as veterinarians to justify why we're recommending food as an investment or medications as an investment or supplements as an investment, because we need evidence that your pet needs these things or doesn't need these things.
I'm so glad that you guys really advocate and give us the truth, because it's honestly so hard. And even learning about things today, I'm like, this is so layered, so multifaceted. There is no one quick answer. It really is like dealing with the human's nutrition, every dog has different needs, different allergies, different life
Yep,
conditions, history.
you
So
got
this
it.
is so fascinating. And uh, you're in the advisory team for a dog food company named Artie. How
Yep.
would you explain Artie and what kind of dog food it is and what your involvement here is?
Yeah. Artie is very unique. I remember the first time I was talking with them, I was like, oh my gosh, that is actually a novel idea. Because they're like, we have an innovative idea. I'm like, you and everybody else out there, right? But I was like, oh, no, this is actually innovative. And so there's a lot of people out there that want to do, warm meals for their pets, but they either don't have the time, the energy, the finances to cook for their pets, or for whatever reason, the fresh frozen option takes up too much refrigerator space, freezer space, whatever it is. And so I would describe Artie as kind of dog ramen, if you will, but think classy ramen, good ramen. So it is complete and balanced. It is shelf stable. So it is all dehydrated. And that's really important because one of the reasons that the fresh frozen options have to be in the freezer, or the shelf stable options have different types of preservatives, or they go through the retort or the canning, is to keep them safe. And having no water added eliminates what is called like the water activity level. And that means that molds aren't going to grow, or they're less likely to grow, bacteria is less likely to grow, things like that. And it takes up less freezer space, kitchen space, all these things. So you have this dry bowl that is pre-measured out in terms of calories, so the pet parents do not have to guess at all. They take a quiz that yours truly designed to help develop a nutrient algorithm, keeping in mind that it works for about 50 to 75% of the patients, but because everybody's a unique individual, there is the ability for the pet parent to go in and be like, nope, they're gaining weight, so you can drop it back, or, oh, they've lost a little weight, you can adjust it, which is very important because animals' needs change as they age. And then it comes with a beautifully manufactured and patented machine that it's like a Keurig and a ramen machine. So you put in the pre-measured bowl, and when you close the lid, it scans a barcode on the bottom. And so it knows exactly how much hot water and steam to add. It's usually between a
Wow.
2 and a 4 minute cycle. And so it rehydrates the food, it warms the food, and then a little bit of cool water is added at the end so that the temperature is between 95 and 105 degrees Fahrenheit, which is the temperature of a body, right? So most mammal bodies are somewhere between like 98. Our dogs are usually 100 to 102. So it's prey temperature, if you will. And there's been a lot of research to show that animals, especially picky animals, do prefer their food to be warm over cold. And having a heated product releases the aromas and the palatants that are in a food. So if there's an issue with olfaction or any other sense, it can improve palatability as well. And so my involvement was pretty early on when they told me the idea. And I was like, yeah, this is novel enough that you actually need to test the hell out of it.
You're,
Which is when
you're
I
like, keep
started
me
being a pain in
busy.
their butt. Yeah, well, I'm basically, yeah. So it went from, being a just kind of like intermittent advisor to them being like, you bother us all the time. So let's just go ahead and add you as our like head advisor. And so these guys, they came at it from the best place, and everybody has a reason, right? So love of their pet and a desire to bring something innovative but good to the market. And when
Mm,
they came to me, they're like, we want to do this right. And I said, if you want to do it right, I'm going to make you mad. And they're like, okay. And I was like, great. You need Africa feeding trials. You need to take all of your samples and send it off to either Midwest or Eurofin labs to get your nutrient analyses, because A plus B doesn't equal C. You need to do
yeah.
digestibility studies. You need to do palatability and acceptability
Wow.
studies. And
Fantastic.
they do pathogen testing. They test
Wow.
for contaminants. They're testing. They're going out and talking to their suppliers. So all of the things that I know the major manufacturers do, which makes me feel comfortable feeding it to my own pets and my patients. I was
Yeah.
like, you want me to recommend your product? You have to check every single one of these boxes for veterinarians to get behind it. And they were like, all right, let's do this. And
I
so
love it.
I'm a pain.
They're lucky to have you. It sounds like it's such a rarity in smaller
It,
craft
it's
or
hard
premium dog
because
food
there's not
companies.
very many of us out there, but they
Yeah.
were willing to listen. So when I first started advising them, I was like, look, I'm willing to help you because you're doing it for the right reason, but you will not put my face, my name, anything. Like, I want you to be transparent. So if somebody's like, who do you work with? Of course you need to tell them. But like, I don't want to be known as the person that helped you make a diet that was bad. Like, nope. And so I finally felt comfortable with like them saying, yes, this is our chief advisor, because they were doing everything that they should have done, which I know is hard on them. And again, it's a testament of them as truly decent human beings.
Yeah.
Because they are doing things that are hard because it's the right reason to do it. And I am proud to be part of Artie because of that. So, and like, I am not here to advertise for them, but if one is interested, I hope that they are willing to give Artie a chance. But they're really, really good humans doing it for the right reason, and they're doing a good job.
I also hope that more pet companies,
Yes.
take that leap and do the right thing, because at
I
the
hope
end of
so
the
too.
day,
There's
like
not
if
very
they
many that do.
exactly, if this is a really good case study for even
Yeah.
like a emerging brand that's doing something right, we're so inspired by that, and we really
Yeah.
hope that other pet companies follow.
Yeah, me too.
Dr. Lindsay, try to bring this home. If you could give all dog parents one piece of advice regarding their dog's diet, what would it be?
I would say that cost and expense does not always indicate a superior product. So just because it is expensive and or labeled as premium doesn't always mean it's better or superior for your pet.
It's incredible advice. Use your discernment.
My parents in the past, they have fed their dog grocery store kibble, and they were like, we know it's trash. I was like, it isn't. It is not trash. Your dog is doing well on it. It's from a company that I've evaluated, and it's not like they hide the research, from the lower tiers. Nope. That is not true at all. Pets can do very, very well on store-bought brands. They sometimes, if they're special, need higher quality ingredients, but cost does not always equate to quality. All right. So just keep that in mind.
Great. Yeah.
We can't thank you enough. We wish we had more time with you. We're going to have you again on in the future because there's so much we could talk to you about. Your
I
wealth of
would love that
knowledge.
so much. You guys are
And
lovely and wonderful and such amazing pet advocates. And I'm just so grateful that you guys were gracious enough to have me on your show and to be willing to listen and to give me a platform to share the knowledge that I have. I'm just so grateful to you guys. Thank you.
Oh, the pleasure is ours. Thank you so much for joining us. We can follow Artie on Instagram, Facebook, and TikTok. Thank you so much, Dr. Lindsay.
Thank you guys. Such a pleasure. And bye, everybody. Thanks for listening.
And thank you, everyone, for tuning in today. Stay tuned for a new episode of MythBarkers.